Hello, everyone. Greetings from COP26 in Glasgow. I'm delighted to be here with you. I'm Maria Neira. I'm a public health officer more than anything else, working at the World Health Organization. And I'm very grateful for this invitation. I'm very happy that UN Contact and the World Business Council are inviting me to have this opportunity with you. And let me tell you something very beautiful that happened this morning. There is a movement called Moms for Clean Air, and they invited me this morning to join them to go to the presidency of the COP to pass a message. Air pollution is killing our children. And the reason why I'm so happy is because when you have moms fighting for clean air, that day when I realized that it was such a movement, I say, okay, we are in the winning path here. I'm sure this battle against air pollution is the one that we are gonna win. Because when you have moms fighting for the health of their children, who will stop them? So we have plenty of optimism, and I think that with your help and all the effort you are doing to pass this message around, we all need to understand that what we are doing here at COP is essentially and fundamentally about human health. When you think that if you tackle the causes of climate change, in fact, what you are doing is promoting basic public health interventions, interventions that will produce healthy diets, will be able to nourish our people and contribute to the problem we have at the moment with nutrition, with more healthy, sustainable food production and consumption. That is already something fantastic that will save millions of lives every year. The second enormous health benefit, if we tackle the causes of climate, particularly if we stop using fossil fuels, will be the benefit of reducing air pollution. And you know that the air we breathe, the one we are breathing now, every single second, because we cannot stop breathing, is killing more than 7 million people every year. Can you imagine? Let me repeat the figure because this is really too much. 7 million people are dying every year because they are breathing air which is toxic. How can we do that to ourselves? We need to make sure that we promote an air that will be protecting ourselves, our health at least. And the way to do it, one of them is stop burning something that will end up in our lungs. So we need to be behind it, the health has to be behind this transition to more renewable, more sustainable sources, cleaner sources of energy. Health has to be behind the movement for this sustainable food production and consumption. And health is behind the movement to make sure that we will have cities where our health will be protected and not at risk as it is now. So I think it's a fantastic cause, a fantastic movement that the health community at large is ready to lead and to drive with the help of people like you organizing it today. Please move on from those fossil fuels. Let's be them fossils. Let's send them back to history and let's reinvent the history now where we will not have so many COPs to just decide that we want to be healthier. We have 26 COPs until now, looking at trying to propose a more sustainable way to be happy and have health in our planet. Now we need to stop with that. We need COP1 for health. Health has to be the one motivating our actions. And the day we will be able to put health at the center, what else will motivate people to act? If people realize that this is not just about the planet, but it's about your lungs, my lungs, and the lungs of the child that is next to me, then that day I think things are gonna change. And that day starts today. This is the COP1 for health, and I count so much on your help, and I thank you enormously for being together today, joining forces, for moving into a cleaner space where we were all constructing at the moment. Thank you so much for your participation and engagement.
Thank you, Dr. Neira, for that warm introduction, and hello and welcome everybody. And thank you for taking the time to join us today for this session. Just to quickly introduce myself, my name is James Gom. I'm the Director of People and Society at the World Business Council for Sustainable Development, or WBCSD, and it's an honor for me to be facilitating this important discussion today. We're currently, as we all know, in the midst of a historic COP, where a wide range of stakeholders are coming together with a really appropriate sense of urgency to advance solutions to accelerate climate recovery. And I think the mood generally so far emerging from these discussions is one of cautious optimism. We've heard a great deal around many topics, from financing our journey to net zero, to ensuring energy security, looking at reforestation, the just transition, all critically important topics. But perhaps arguably the one topic we haven't heard enough about this week is the crucial intersection of climate, health, and equity. So that's why I'm really delighted to have this chance now for us to explore this critical topic today in a bit more detail and dive into some of the opportunities to prioritize climate actions that could provide benefits to public health, especially for those who are the most vulnerable in our societies. So a big thank you, first of all, to Biogen for hosting this session as part of the UN Global Compact's Caring for Climate event during COP26. A brief technical note before we get started. The audience are in listen and view mode only today, but please do feel free to interact with our panelists by using the chat feature and typing your questions in there, and they will get back to you with some very insightful answers, I'm sure. But without further ado, I'd like to get cracking and introduce our panelists. And we have a fantastic panel today, and I'd like to start by inviting them to briefly introduce themselves. So Noelle, if we could start with you, please.
Hi, I'm Noelle Celine. I'm a professor at the Massachusetts Institute of Technology in our Institute for Data Systems and Society and Department of Earth, Atmospheric and Planetary Sciences. And I'm also director of MIT's Technology and Policy Program.
Wonderful. Welcome, Noelle. Kevin, if we could turn to you, please.
My name is Kevin Chipatel, he, him pronouns. I'm from Los Angeles, California, currently in Glasgow for COP26. I am the founder and executive director of One Up Action International, as well as a student at Loyola Marymount University in Los Angeles.
Great to have you with us, Kevin. And I hope the culture shock of going straight from California to Glasgow isn't too extreme for you. Jennifer, if we can go to you, please.
Yeah, thank you. So I'm Jennifer Wright, and I head up our sustainability function at Biogen. Closely work with our corporate responsibility folks in all things that are related to healthy climate, healthy lives, which you'll hear a little bit more about today.
And finally, Nick, over to you, please.
So hi, hello, my name is Nick Watts. I am the Chief Sustainability Officer for the NHS. I am here in sunny Glasgow with the world's first healthcare system to make a net zero commitment. We're really excited to be on this panel.
Great, welcome everybody. So to get things started, in all the conversations that we're seeing around COP26 this week, around limiting global warming to 1.5 degrees, health is not necessarily always at the center of those conversations. And we're perhaps not framing this climate crisis as a health crisis in all of our interactions. Noelle, can I turn to you first of all to unpack a little bit for us how the climate change relates to human health and some of the consequences that ongoing climate change look to have for our health, particularly for those people in marginalized communities?
Sure, absolutely. And this is really an instance of climate being an overarching challenge and an overarching challenge for sustainability. The connections of climate change to health are really emblematic of why climate is a big problem that touches every single sector. And because climate affects food, it affects floods, it affects heat, it affects wildfires, all of these things and all of these connections across Earth's life support systems have really important impacts on people's health, both today and also into the future. So you think about the impacts of heat, for example, on people's health and people's well-being, impacts on diseases. The area that I work on most specifically is air pollution, and the links between climate and air pollution are strong and are multifaceted. So climate change impacts air pollution because air pollution is outdoor. It leads to several million deaths a year. And climate getting warmer can, in some places, increase air pollution, increase exposure to air pollution. One mechanism of climate influencing the source of air pollution is wildfires. So increased wildfires lead to more exposure to particulate matter in the atmosphere and lead to mortalities and morbidities. But also there's source connections as well. So efforts to mitigate climate change through controlling sources, such as power plants and transportation related sources, fossil fuel burning, can also help benefit human health. So the connections really are multifaceted. And as I think about impacts on marginalized communities, I think about some of the environmental justice issues. We know that in particular pollution exposure to different communities, there are substantial disparities. For example, here in the United States, we know that low-income and minority populations are exposed to more air pollution. And so climate change can intersect with that exposure, but also efforts to mitigate climate change could help address those disparities. And so part of what I do is trying to figure out how and map that problem.
Wonderful, thank you, Noelle. That's a very comprehensive overview, and look forward to digging into some of those topics a bit more during the course of the panel. So Nick, turning to you, the NHS has a bold ambition for net zero. Can you provide an overview for us of the NHS net zero commitment, including how it got started and some of the work you already have underway?
You're entirely right. The NHS does have a bold commitment to net zero. We like to think of it as both ambitious but feasible. For the emissions we control directly, we're going to get to net zero by 2040. We're going to get to an 80% reduction by 2028, and that is soon. We're good health professionals, and we understand that health doesn't start or stop within the four walls of a hospital. And so we're going to take account of the entire emissions footprint of the NHS, the global emissions footprint as well. And for that, 2045, what does it look like? It looks like everything you can imagine. It looks like climate smart healthcare, climate smart investments into our hospitals, into our clinics. It looks like changing the way that we think about how patients move through the system. It looks like shifting our prescribing habits. It looks like nutritious food. It looks like cleaner air. It looks like a zero emission ambulance. And this is the world's first zero emission ambulance. There are two in existence. One of them is fully electric. It's in Birmingham right now carrying patients. And there's one right behind me, electric, hydrogen, hybrid. Goes over 300 miles on a single charge. That's what a net zero healthcare system looks like.
Kevin, I know this is really a personal issue for you. So could you tell us a little bit about how your own health has been impacted by climate change and air pollution, and how that's inspired you to do what you're doing?
Of course, at the age of 12, I was directly impacted by the air pollution and smog pollution that ravages South Central Los Angeles, or Los Angeles in general. Really, air pollution is caused by a multitude of factors, but the main cause of air pollution and smog pollution is the fossil fuel industry. And it was right in our backyards. So we can see that there's quite a lot of cars in Los Angeles as people are driving, which causes air pollution. We have the factories that are causing air pollution. Then we have the oil wells, the drilling that's happening in communities like Wilmington and Inglewood that is also causing quite a lot of air pollution and smog pollution. And there's a lot of different other factors that is causing air pollution and smog pollution. So really, when I was directly impacted by the air pollution and smog pollution, I said enough is enough, because it's not just causing irregular heartbeat and heart palpitations, it's causing cancer, it's causing asthma, it's causing all these other health effects that are impacting my community. And so I wanted to act upon it and do something. And ever since then, I've been acting.
Fantastic. Thank you, Kevin. Really brings it home to hear about the impact in that personal way. Jennifer, I think Kevin's story really underscores the importance of bold action. I know that public health is right to the heart of everything that Biogen does. So could I turn to you to talk to us a little bit about how Biogen Biogen's long-standing climate action, I guess, is dealing with some of these issues around health and equity.
Yeah, great. Thanks for sharing that, Kevin. That's it's an eye-opener for sure. Yes, so Biogen became carbon neutral back in 2014, right? Because we knew that we had to do something about our carbon footprint. But starting in around 2019, it became clear that we needed to do more, right, and be more aggressive with our commitments at carbon reduction, because the climate science was really showing that carbon neutrality and relying on offsets just wasn't good enough, right, to limit the rise in global temperature to 1.5 degrees. So, this is even more important today, a couple of years later, given the latest reports on climate change. So at the same time, we were thinking about our carbon emissions. We were thinking, that we're a healthcare company. We're in the business of, helping people stay healthy. So we began to consider the human health impacts attributed to pollution from burning fossil fuels. And as we researched this link further, we were really struck by this growing body of research that suggests fossil fuels may impact brain health, in addition to things like heart disease and chronic respiratory illnesses, some of what Kevin was describing. And so, and if you go one step further into that research, you'll also see that the most vulnerable communities are definitely disproportionately impacted, as Noelle mentioned, by climate change. So, as a neurology company focused on science, we knew we had to develop a strategy that could address, climate health and equity together as a single and urgent challenge. So the result was our signature initiative that we call Healthy Climate, Healthy Lives. It was launched back in 2020. And it was a $250 million commitment to become fossil fuel free in our own operations by 2040. So that means getting to actual zero greenhouse gas emissions for scope 1 and 2 emissions, which is actually aligned with the most current net zero guidance, and addresses the health impacts of pollution as well as carbon. And also central to Healthy Climate, Healthy Lives are activities around engaging with our employees, our suppliers, which obviously is a big part of our footprint, and other stakeholders to advance our goals, because we know it's going to take everyone working together to be successful in this space.
Great, thank you, Jennifer. Noelle, if we could turn back to you, I think one of the topics we hear a lot about in this space is the idea of climate health co-benefits. So could you explain to us, first of all, what does that mean? And what does it take to deliver strategies that deliver these kind of co-benefits?
So yes, I think one of the key elements of my research over the past decade has been to really understand better what the impacts of efforts to mitigate climate change are. So this is sometimes called co-benefits, and that efforts to mitigate climate change also impact human health. But I prefer to really think of them as co-impacts, right? Depending on who you are and what your impact is, these are things that should be looked at as part of the same package of thinking about what the benefits of different kinds of actions that mitigate climate change and have benefits to human health are. So what the research in this area has really shown is that efforts that reduce greenhouse gas emissions also can benefit human health by reducing the emission of pollutants that form air pollution, like particulate matter, fine particulate matter, and ozone in the atmosphere, and can reduce the deaths that are associated with those. So there's a large body of research that says that these benefits are substantial, and these benefits are very near term. So that case is really made. What is interesting and sort of the frontier of research in this area is to think about some of those distributional questions. So providing some granular information about the pathway that both companies and nations take to meet a 1.5 or 2 degree goal, and what kinds of ways health can be embedded in the decision making of what greenhouse gases to cut when and in what order. And those can have really differential impacts on the other kinds of pollutants that are emitted from these same sources, and have impacts on human health in different places, in different ways, and on different timescales. So my research really tries to provide that kind of granular information to a wide variety of stakeholder communities. For example, thinking about the relative impacts of power plants and transportation, and how in a very highly nonlinear system of the atmosphere, those really interact. We use a variety of different models, both of the integrating models of the economy and policy with models of how air pollution travels and the climate, and how people are impacted by that pollution, really trying to dive down to provide that information about the health outcomes that will be achieved by different policies in order to help stakeholders make better decisions.
Fantastic, thank you, Noelle. That's very clear and very helpful. Turning to you again, how might the NHS engage key stakeholders from patients to suppliers and even other health systems around the world? What's the process there for that stakeholder engagement?
Partnership is key. Partnership is everything when it comes to the response to climate change. The climate crisis is a health crisis. It affects absolutely everyone around the world. No country, no individual in England, in the United Kingdom, anywhere in the world is immune from the health impacts of climate change. And so the response has to include everyone. That means all 1.4 million of the NHS staff, 1.4 million healthcare workers across England. That means all of our patients, the public, but yes, it also means countries around the world. The NHS has been, and we're really proud of this, so we'll say it again, the world's first healthcare system to make a net zero commitment. I promise you, by the time this conference is out here up in Glasgow at the UN, we won't be the last. We know that it is essential that we have everyone there, and that extends as well to some of our friends on this panel. It extends to our supply chain as well, because we know that to be truly net zero, all of us have to get there together.
Kevin, if we could turn back to you, I think your organization is a great example of one kind of stakeholder group that it would be really important to engage as we look to set policies and sorts of targets related to the types of impacts that Noelle's talking about. So could I ask you to speak a little bit more about how you see the intersection of health equity and climate justice, and what your organization's doing to address this issue?
Of course, yeah, young people, we're taunted to be the generation of tomorrow, or the future of tomorrow. And I think that is completely wrong. We are not only the generation of tomorrow or the future of tomorrow, we are the generation of today. We are the leaders of today, the change makers of today, and really bringing to light new solutions that are going to solve the inequities and injustices that we are currently facing. And so One Up Action, an organization I founded in 2019, really supports young leaders who haven't been supported within these spaces to pursue their actions, pursue their solutions, and making sure that they can create greater impact within their communities. But the way that I see health and equity and climate all intersect, I know Noelle said it intersects, and how we must connect the dots, right? This issue is intersectional, and if we're not connecting the dots, we're never going to solve this the climate crisis. We will never solve the social injustices that are happening to communities, especially low-income communities all around the world. But how climate, health, and equity really intersect for me, as I was mentioning before, I was affected when I was 12 years old, when I saw how my community of Southern California, or South LA, was really ravaged with air pollution and smog pollution. And I connected those dots by seeing how low-income community members, such as myself, were, didn't have little to no access to resources. What does that mean? When we're looking at food inequity, a lot of the communities, especially mine, do not have access to non-GMO organic food options, while affluent community members did. And when you're looking at tree equity, who has more trees within a neighborhood? Not a lot of trees were in South LA. And when you go to the Calabasas or the Beverly Hills area, you would see a lot more trees there than you would in marginalized communities. And so really seeing how, those two issues really were intersectional, of how affluent communities were getting many more resources, and low-income communities and marginalized communities, such as mine, were not. I was able to connect the dots to say, okay, well, if my community is not receiving any resources, then my community is getting the brunt of the climate crisis. But how are we really getting the brunt of the climate crisis? And how is everything intersectional, right? When we're looking at the fossil fuel industry, they're in the backyards of marginalized communities. So it's the lack of power and voice that marginalized communities don't have, that is causing these issues to prevail and really cause, adverse effects within, not only my community, but communities across the nation and across the world. And so when it comes to exposure to poor air quality and water quality and all of these other injustices, Black, Indigenous people of color are disproportionately affected. And we must see this issue as intersectional.
Wonderful, thank you, Kevin. That's really powerful. This idea of giving voice to the voiceless when it comes to this issue. And sticking with that theme, Jennifer, maybe if I can come back to you, this idea of giving voices to stakeholder groups that perhaps don't have the loudest voice, this idea of engaging with different stakeholders as we plan the solutions and the actions to drive impact in this space. Could I ask you a little bit about how Biogen is looking beyond its own operations and working with other stakeholder groups to strengthen healthcare systems that better address climate, health, and equity issues?
Sure. Yeah, so earlier I mentioned our fossil fuel free commitment, which was sort of on the climate side, but the second part of Healthy Climate, Healthy Lives is addressing, healthcare and equity. And so part of our commitment involves several collaborations focusing on strengthening healthcare systems, especially in those vulnerable communities that may not have a voice, as Kevin said. We know they're being hardest hit by climate-related events. So we're partnering with the Chan School of Public Health at Harvard on a couple of things. One is with AmeriCares to help these under-resourced health clinics address climate risks in their operations and in their patient care. As part of the pilot, we engaged with 9 clinics and surveyed more than 470 clinic staff from 47 states across the US to get their real world insights. And those insights, that feedback is being used to put together a first of its kind toolkit on climate resiliency that these clinics will be able to use to provide better healthcare and systems to those patients in those communities. Also with Harvard, we're conducting a comprehensive and current meta-analysis, probably the most comprehensive to date, on air pollution and dementia, including studies from 9 countries and 3 continents. Our hope is that this will help us understand the potential linkages there and inform further research in this field. And lastly, but certainly not least, Biogen is proud to co-chair with you, James, a project you're heading up with WBCSD to engage the corporate sector to advance climate and health, as well as the World Economic Forum on issues of climate and air pollution, Noelle and MIT, a variety of projects there to advance the science and bridge research to policy gaps. So we're really fortunate to be working with some really great dedicated partners and collaborators. And like I said before, it's going to take all sectors working together. So hopefully this is just the beginning of some of those collaborations that we can put together.
Wonderful. Thank you, Jennifer. And thank you for your leadership through Biogen as part of WBCSD in this space as well. I know it's an area that companies that are active in the healthcare space or the life sciences space are very, very up to date with and very on top of, but I think there is a dramatic and an urgent need to spread that message throughout the broader business community and to really encourage every company out there to put health at the center of not only its climate strategy, but of its general business strategy. So thank you for your leadership there too. We've talked a lot about the need for impacts, and obviously impacts need measurement systems. What gets measured gets managed. So there is a need for clear management metrics, targets along the way to measure our progress. So Noelle, do we have what we need right now to be able to measure impacts, or do we need a new model to highlight the ways that climate and health intersect, and how could that help decision makers better, do you think?
Yeah, thanks for that question. Definitely, we do need new ways to quantify and measure how all of these issues that intersect, how we're making progress on them, and what impacts different kinds of interventions will have on climate and health as a combined issue. Basically, this intersects with a lot of efforts on how do we think about human well-being today and in the future? How do we measure what the impacts of our near-term actions are? And we're particularly happy to be working with Biogen on this, because one of the things that I found is that companies that are thinking really hard about their fossil-free commitments, really want to know what the impact of those actions are and want to prioritize actions and think about what pathways they can take. And there really isn't that information and clear, concise metrics that can look at the holistic nature of this problem yet. So some of the modeling that we're doing are really looking at how you prioritize metrics for health in the context of human well-being as we think about these different climate goals. We have the benefit in the climate space of being able to all talk about, how our commitments are reaching either 2 degrees or 1.5 degrees, and that's a common measure that we can all agree on and think about in terms of measuring how far we're progressing towards those different goals. But 1.5 and 2 degree future, that will certainly do a lot. It'll do a ton for health because of these intersections, but it won't solve all of our human sustainability problems. So how do we think about measuring that progress towards greater sustainability and getting indicators that will not just be about temperature, but will really capture what humans are experiencing now and likely to experience in the future. And this is particularly important because the kinds of timescales that we're thinking about with investments in some of these fossil-free commitments, as well as infrastructure investments, really stretch out for decades. So my work in developing this new model together with the team at MIT is really trying to think through ways we can get more granular information, more targeted information, and also work together with stakeholders to implement this. So part of that is at the MIT Technology and Policy Program, we have a research to policy engagement initiative, which has benefited also from Biogen support and thinking about how we communicate our work, how we think about embedding that direction, and how we think about engaging communities who are affected by pollution and embed their priorities in our modeling and in the metrics that we create.
Well, thank you, Noelle. And I guess that issue of progress brings me back to you, Jennifer. In terms of tracking targets and looking at how we're doing, with the messages coming out of COP26 around the need for urgency. I'm sure activists like Kevin are also telling us that we need to move further, faster. So how are you assessing Biogen's progress at the moment, and what have you learned, and what are the lessons moving forward?
Sure, thanks. Yeah, so as I mentioned, Healthy Climate, Healthy Lives is a 20-year commitment. So we're looking at fossil fuel free by 2040. But we know that there's urgency around this, and so we've also set some short and medium term targets. For example, we're transitioning our fleet of vehicles to all electric vehicles by 2025. Looking at eliminating PVC and plastic trays in our finished goods packaging by 2025. And although we're trying to get to 100%, reduction in greenhouse gas emissions by 2040, we have a science-based target that says we'll do 55% reduction by 2032. And we've come up with what we call our sustainable drug development principles that we are planning to implement across all modalities and new products by 2030. So these are just a few examples of some of the ways we're trying to have an impact in the shorter term, knowing that so many of these goals are decades away, as Noelle just mentioned. And so how are we doing? I can share a little bit of progress just from year one of Healthy Climate, Healthy Life. We did a lot of standing the program up, but I'm happy to say that we've had some success. So we've maintained 100% renewable electricity across our company globally, and we're looking into virtual power purchase agreements now for our North America demand as a way to sort of invest in in new renewable infrastructure. We enrolled 13 countries in our EV pilot program, and we've ordered over 110 battery electric vehicles so far. So we still have a ways to go for our 2025 target, but we're well on our way. We collaborated with a group called My Green Labs on a pilot project in our R&D and product development labs this year. We wanted to, number one, engage with our laboratory employees on what they could do to contribute, and obviously to make environmental improvements in how we manage our laboratories, everything from energy to water to waste. And lastly, I'll say we're looking into ways to better understand the impacts of our products, right, on the environment and on people, to drive innovation and continuous improvement, mostly through the life cycle analysis process. And I guess I'll end with talking about Scope 3, right? So similar to NHS and many others, Scope 3 supply chain emissions are, a significant focus for us since they're the majority of our carbon footprint. As part of our approved science-based target, we have an engagement target And we're asking our key suppliers to set their own science-based targets by 2025. So again, a short-term goal, right, to get them to accelerate their progress. We're also asking them to switch to renewable electricity by 2030. And in fact, just yesterday, Biogen, along with, I think, 8 other pharma companies and Schneider Electric, launched something we're calling Energize, which is a program to help our suppliers across the pharma industry access renewable electricity through power purchase agreements. So that's really exciting example of how we can directly engage with our suppliers to accelerate their performance and their transition. So we'll continue to focus on scope 3 through these direct engagements with our key suppliers, because it's a critical part of our ambition.
What do you see as the biggest changes needed to deliver on the NHS goals, whether it's operations, mindsets, or whatever? What are those changes that you need to see?
What are the biggest changes that you need to deliver a net zero healthcare system? Think of everything you know about what healthcare is. Think about the goods that we use. Think about the way that we dispose of them. Think about the way that patients move through the system. Think about what a hospital looks like. All of that has to change. This agenda is about redefining, reimagining, reconstructing what it means to be a healthcare system, what it means to be a healthcare professional. It is absolutely everything. And that's what's, I think, really scary, but also really exciting about a concept as big, as bold as net zero healthcare by 2040 for the NHS, but there will be others. It doesn't just mean do 1 or 2 things. It doesn't just mean do the top 10 things. It means you get a list of everything you could possibly imagine and you do all of those things. And then you go and find another 20 things, and then you go and find another 20 things. You keep going until you've gone as far as you possibly can. And then when you think you've gone as far as you possibly can, you innovate. Net zero healthcare is not just about low carbon healthcare. It's not just about a response to climate change. It's the future of healthcare.
Maybe I can turn now to some questions for all of you. We're all on COP watch this week. We're trying to figure out what's going on. It's almost impossible to keep track of everything. So it's literally an event happening every minute of every day. But from what you've seen so far going on at COP, are you hopeful? Are you think we're moving in the right direction? And particularly, do you think this issue has been one that's being raised enough? Is there anything particularly around this issue that coming out of the COP discussions that has struck you? So maybe we can start with you, Kevin.
Of course, I don't think, one of the things that I just don't think that we are ambitious enough. Countries are not ambitious enough. World leaders and corporations are not ambitious enough to meet the mark of climate change and really reversing the effects of climate change. Although I'm optimistic, given that the young people are here, but quite a lot of people that are supposed to be here from the global north and global south who are directly impacted by the climate crisis are not. A lot of those voices are being left out of the conversation and at the decision-making tables. I wish a lot more of the global north and global south and those who are directly impacted, especially the global south, those in the global south that are directly impacted by the climate crisis were here to talk about what's happening in their communities. And I feel like I didn't do justice to the second question you asked me about how I see the intersections between health, climate, and equity. And really, 3 points: pre-existing health status, living and working conditions, and then the lack of power and voice, which I mentioned earlier. And so all these 3 things really is something that I'm not seeing within COP26. I have attended multiple meetings where with CEOs from the biggest companies in the world, and a lot of the conversations that are being had are not intersectional. A lot of it's just single issue focus. And many of the world governments and corporations are not tending to focus on what it means to get justice for low income and marginalized communities. And that is very concerning, especially for me, given that I was directly impacted in Los Angeles by the air and smog pollution. And I know millions of young people who are across the world, especially the ones that are here at COP, feel that they've been left out of the conversation. Yes, we've been invited, but we are not able to go into the negotiation rooms and really talk to our leaders and say, this is what we want to see from COP26, and really putting together a bold plan for the future and for now as well.
What strikes me most about COP26? I mean, there's so much going on, right? It's a difficult question to answer. There are people from every country of the world. There are doctors, nurses, physiotherapists, all dedicating their time, their lives to the response to the climate crisis. What strikes me the most is that there is a buzz in the air, a little bit of a spring in people's step, a little bit of a glint in some people's eyes. I think that people can tell that there's a bit of a sea change, that for a very long time, we have been talking and talking and talking about talking, and that's changing. People are moving into the delivery phase of this. Big healthcare systems are starting to take this incredibly seriously. The World Health Organization, Maria Neira, taking this incredibly seriously. And I think you can feel it. And I think people are getting excited. People are noticing that the bar for what constitutes acceptable progress, acceptable responses to climate change has shifted. I think people are really looking forward to the challenge that comes from moving from talking into delivery.
Noelle, Jennifer, any other thoughts on COP?
Well, I have got a couple of thoughts. One is it seems that we've definitely made progress in moving health more towards the center of the dialogue with climate, right? So I think there's a lot more talk about health and climate and not just carbon. And to that point too, I think, we've been hearing some people talk about methane as well, which we know is even a more potent greenhouse gas. And so I'll be very interested to see what comes of that conversation once COP is over and everybody goes back home and rolls up their sleeves to get to work. And I think the other thing is, in the post-COVID world, we've been dealing with this pandemic for a while. It does feel like there's a bit more sense of urgency around this topic, right? I mean, I think we've got a lot of world leaders coming together, making bold statements. And, to your point, Kevin, not everybody's voice may be heard, but I do think that there is sort of a newer sense of urgency here that should make us a little optimistic. I mean, we've got a tough road ahead of us, but we have a lot of people that are coming to the table to try their best. And I hope that, like I said, when leaders go back to their countries and they have to deal with realities, that we can still make some progress based on the lofty conversations we've been hearing about.
Yeah, definitely. I didn't mean to seem pessimistic. I definitely am seeing a lot of progress from a lot of people, especially local communities. And I think that's when we see local communities coming together and really putting together bold, ambitious plans that are intersectional with health, with equity, with climate justice, and all these other social injustices, we can really make a difference. And that local action can lead to global action. And so that's exactly what we're looking for. And companies, don't get me wrong, they have been making progress. And I think a lot of the young people, especially I, would love to see more companies take bold, decisive action on climate change. But we will see once everyone goes back home and rolls up their sleeves, as you said, Jennifer.
We need you to keep pushing us, Kevin.
Thank you.
Cool. Noelle, any thoughts on, even aside from COP generally, is there anything that's giving you cause for optimism, or is it all pessimism?
Well, I really think about this on sort of two different levels. And one is the purely thinking about the greenhouse gas emissions and commitments level. And while we certainly see the ratcheting up of different commitments, we're still really awaiting that directional change. Green emissions are moving in the wrong direction. They need to start moving very, very rapidly in the right direction. So, while these commitments are important, I'm really eagerly awaiting seeing the fruits of those, seeing action. And I think there certainly is momentum of trying to get that done in implementation. But that's really the sort of importance of getting these discussions going, but also, again, as was said earlier, going back home and trying to implement that. But the related point is that what gives me optimism is really thinking about the frame shift that is involved with making zero commitments. And I think the realization that greenhouse gases have to get to zero, and the commitments that companies and countries and cities are making. Once you have made that commitment, it really sort of changes your thinking about how to both prioritize reductions, how to think about the entire system, and sort of realize not only what it takes to get there, but also what that future will look like and how we conceive of that that zero future that we all hope to see in order to fulfill the 1.5 degree goal. So what I see increasingly in the discussions that really surround the COP is how do we get our heads around that that frame shift? What kinds of science are we using? What kinds of information do we need? And really, what does that future look like, and how will people benefit from that? And that's a conversation I'm really excited about participating in.
Absolutely, and it's a really interesting area. I think that idea of the mindsets that have to shift in order for us to make progress on this across different stakeholder groups, and maybe that's another question to think about as a group. How do we get the right information out of the silos that it sits into the right hands for people to do what they need to do with it? So across different stakeholder groups, whether it's impacts being felt on the ground by stakeholders, whether it's new emerging science coming out of the academic community, and indeed the challenges that the business is facing on the implementation side. How do we ensure this flow of information across those stakeholder groups? Any thoughts on that?
I definitely have some thoughts on this, given that I was speaking to a lot of the CEOs of some of the major companies that are attending COP. And a lot of the conversations that I had in facilitating were really short, but I think, it was an echo chamber, given that a lot of the ideas and solutions are just going around people who are at COP26 and not going out to the general public. And so it's also meeting the mark of like, okay, where can we find the in-betweens? Because everyone that's at COP26 is not always in the same, the same agreement of, how progressive or how what solutions should really be implemented. So we can see I think Jennifer mentioned the methane and how methane has been included in the conversation, but quite a lot of people don't think methane should be a solution to getting rid of fossil fuels. And so a lot of these conversations should be had of meeting the mark within our circles, and then kind of in turn looking at the people who are not actually knowing about climate or health or equity or these other intersections on climate. And that could look like the general public as well as those who just don't believe in climate, and bringing them into the conversation and saying, hey, climate will affect you. It might not affect you now, but it will affect you in 5 to 7 years. And it's already affecting many communities day by day. So I definitely think it's about making sure that we are open to meeting the mark or meeting where we're at within our circles, and then going outside and kind of saying, okay, well, this is what climate change is. This is what you can do about it. This is all the information. This is how you're being affected. And really talking to your stakeholder groups.
So I can weigh on that. I think about sort of how you post that question, and think about, how does the information get into the right hands? And if that's the first time I'm thinking about that question, then I haven't really done my job as a researcher in this area. I should be thinking about that as I'm creating and shaping the information so that it will be more useful. And that really takes engagement. That takes engagement at the front end of shaping questions, of an iterative process that tries to understand different perspectives and engages with the users of that information as we're actually pulling it together and organizing it and providing it in ways that can enhance decision making. So I think of this as sort of an ecosystem of interaction that really needs to happen and needs to be accelerated on in particular climate and health.
Yeah, I don't have too much more to add. I mean, I'm in total agreement. I think bringing those folks into the conversation that may not have been included is important. And when you're dealing with a room full of CEOs, sometimes it's hard to bring other people in, right? But I think about that work I mentioned with AmeriCares, right, where we're going out to these clinics in these neighborhoods, right? They probably haven't participated in these conversations in the past, right? Thinking about climate resiliency and how their patients are going to access healthcare when they're impacted by climate change. and using that input to turn around and give them some resources to help them deal with their day-to-day and in and out challenges. More of that, right, needs to happen at the community level, I think. So I'm agreeing with you guys for sure.
As a young person, I forgot to mention, in the university and even the high school and levels, we don't see climate education being present. So a lot of young people are just not learning about climate and their intersections. And so it's really interesting talking to my peers who might not have nothing to do about climate, trying to connect the dots of like food injustice, tree inequity, and health justice, and how people are being affected by the fossil fuel industry and all these other corporations and industries that are causing the climate crisis. So it's definitely quite interesting to say the least, but I think education needs to be at the forefront of making sure that young people, not just the generation of tomorrow, but today, is well aware of the climate crisis and its intersections, to really bring upon the solution and actions to make a difference. And then really having that intergenerational conversations with older generations as well as younger generations to solve the climate crisis.
Thank you. That's really interesting. And I think from a business perspective, it's often left out of the narrative for business action by many companies. And then also I think that the communication of the positive impacts that certain types of business action are having on health is then also not either not understood or not perhaps communicated enough. So I think, how do we get, Jennifer, more companies to be where they need to be in terms of understanding the interactions between climate and health, and then to be flagging or to be talking about it more, to be educating their customers, their consumers, to be educating each other, to have this as something that companies are reporting about in terms of not just we've reduced emissions by X, but also we've had positive impact on X amount of lives and health conditions.
Yeah. Well, I mean, I think one of the things, a lot of companies do these materiality assessments, right, to inform their climate strategies. And, I like to think like, human health is material to every company out there, right? So whatever your strategy is for dealing with, climate, the environment, sustainability, whatever you call it, human health goes hand in hand with that. And you can't really do one without the other. And I think that the world is, like I said, post-COVID is starting to realize that, right? That these things are inextricably linked, and you can't really disentangle them. You've got to address them together. So, we being a healthcare company, maybe that was more obvious to us, right? Because that's our sector. But I think all companies need to think about their strategy in terms of climate, health, and equity, because these are, our communities where we live, where we work, our families, friends, everyone lives and works. And if we collaborate, with those communities, with partners like MIT and Harvard and Kevin's company, those kinds of things, right? We can move the needle, and everybody will benefit as a result. So I think making health material to your business is essential, right? It's material to every business out there.
Great. Well, yeah, we could talk all day. I'm sure we could. But we do have to stop. I'm sure there's another COP event to run off to. But maybe I can ask each of you just to share some closing thoughts on the topic. What you're maybe hoping to see throughout the rest of your time at COP, and moving forward, what you're hoping that happens in this critical space. So maybe Noelle, we could start with you.
Sure. I think the most important message that I could give is that, climate change is a major problem, but it's only one dimension of the multifaceted challenges that are facing people and the earth going forward in the next several decades. And climate change is a substantial and potentially the most important piece of ensuring human well-being now and in the future, but there are lots of other things to do. And scientific research and bridging to action can help us understand those linkages and really inform better actions that will help people and their health today and in the future.
My closing thought is something I think I say quite a lot. Climate change has been about talking for a long time. It is changing. It is moving into delivery. And that means that everyone, all of us have to start asking, what can I personally do? What piece of carbon, yeah, in my personal life, of course, but also in my professional life, what piece of carbon do I have direct control over? And what can I do tomorrow morning? When you start to do something tomorrow morning to reduce your carbon footprint, to tackle climate change, and then you do it the next day, and then you do it the day after that, and the day after that, and maybe you take a break on Sunday, and then you start again. That's how you deliver a net zero healthcare system. For us, 1.4 million decisions every single day of every week, month, year, until we get there.
Kevin, into you for some closing thoughts.
Of course, I would just say, again, we will not be able to get climate justice or health justice, right, if our solutions aren't intersectional. If we're not connecting the dots, we will never get the justice that we're seeking. So we must have intersectional solutions to solve the intersectional issues that we are facing.
Wonderful, very important point. And Jennifer, closing with you, please.
Yeah, thanks. So first off, I'd like to thank everybody for their time today. I think this has been a great conversation, and this is where it starts, right? Having the conversation about the intersection is how we get the conversation going. So thank you for that. And thank you, James. Yeah, I think, we touched on this earlier. I really hope that, COP will result in some real action to address both climate and health. Because it's easy to have these panel discussions and make pledges, but the real work, is extremely challenging, and it's fraught with obstacles. And we all know, I think, what we're up against, but we know where the science is telling us we need to go. So we may not know exactly how we're going to get there, but I think, we need to get comfortable with that and be okay with some unknowns. And, be steadfast and aggressive in our commitments and actions, and not get discouraged, even when it doesn't seem like things are going in the right direction. We can keep rowing that boat. So I'm more optimistic than ever, as I hear updates that we can protect humanity and nature through our ambitions. And we need to be those moms fighting for our children, as Dr. Neera so poignantly stated earlier in her opening remarks. So thank you guys very much.
Wonderful. Thank you all for the great contributions and a fantastic air of optimism, I think, matching the optimism that's coming out of the discussions at COP. So thank you all, and really appreciate you sharing your insights and experience on this critical issue. If you're interested in learning more, please visit Biogen's UN Content Studio, and the details will be available in the chat there. So lots more information to find out there. And I'd just like to thank you all in the audience for joining us for this important dialogue on how to create a healthier, more equitable and sustainable world. Thank you very much for your time, and we look forward to continuing the conversation with you in both the virtual and hopefully real worlds very soon. So thank you very much for your time.
Thank you.